Hello everyone, and welcome to episode 2 of this series where we explore the most pressing and complex issues in medical ethics. Today, we're diving into a highly charged topic that touches the core of medical ethics. Is it ethical to override a patient's wishes if they are not in their right mind? Joining us are two experts in the field, Dr. Marcus Fields, a renowned bioethicist, and Dr. Jen Kowalski, a practicing physician with years of experience on the front lines of patient care. Thank you both for being here.
Thank you for having me.
Glad to be here.
Let's start with the central question. Dr. Fields, from an ethical standpoint, is it ever justifiable to override a patient's wishes if they are not in their right mind?
Ethically speaking, it's a complicated issue. Autonomy is one of the fundamental principles of bioethics. However, autonomy presumes that the individual is capable of making rational decisions. When a patient is not in their right mind, whether due to a psychiatric condition, cognitive impairment, or acute distress, their ability to exercise true autonomy is compromised. In such cases, overriding their wishes might be ethically justifiable if it prevents harm or promotes well-being, which aligns with the principle of beneficence.
While I agree that autonomy is crucial, as a practicing physician, I face situations where patients might refuse life-saving treatment due to altered mental states. For example, a patient with severe depression might refuse food or medication. In those moments, as a doctor, my first instinct is to save that life. But the dilemma lies in the question of whether I'm respecting the patient's autonomy or taking away their right to make decisions, even if those decisions seem irrational. One scenario that comes to mind is a patient with severe schizophrenia who refuses antipsychotic medication because they believe it's harmful. In such a case, if we honor their wishes, we risk their mental and physical well-being, but overriding their decision feels like a violation of their personal freedom.
That's a powerful example. However, I would argue that when a patient's decision-making capacity is impaired to the extent that they cannot understand the consequences of their actions, their autonomy is, in a sense, already compromised. The ethical responsibility then shifts to ensuring their well-being, which might require temporarily overriding their expressed wishes. The tricky part is determining when a patient is truly not in their right mind. It's not always black and white, and that's where ethics, medicine, and law often intersect.
Dr. Fields, how do we determine if someone is not in their right mind? Who gets to make that call?
The determination typically involves a combination of clinical evaluation and legal standards. Competency is a legal determination made by a court, while capacity is a clinical assessment that can be made by physicians. In medicine, we assess a patient's ability to understand their condition, the treatment options, and the potential consequences of their choices. If they lack that capacity, the ethical imperative to protect them might outweigh their expressed wishes. But this determination must be made with great care to avoid paternalism.
And that's where the challenges arise in practice. For instance, I once had a patient with Alzheimer's who insisted on leaving the hospital, even though it was clear that she wasn't aware of her surroundings and was in no condition to care for herself. Legally, she was not deemed incompetent, but clinically, her cognitive decline was evident. I had to make the tough call to prevent her from leaving, which she perceived as a violation of her freedom. These decisions are emotionally taxing because as a doctor, you want to respect your patient, but you also don't want to let them harm themselves.
Speaking of family, how should their input factor into these decisions? Should family members have the power to override a patient's wishes if they believe the patient is not in their right mind?
Family input is critical, but it should not be the sole determinant. Families are often driven by emotions and may struggle with the idea of letting go, leading them to push for treatments that the patient would have refused. Ideally, the patient's previously expressed wishes, as documented in an advance directive or living will, should guide the decision. Family members should be involved, but their role is to help interpret those wishes rather than override them. That said, in the absence of clear directives, families may have to make tough decisions, and their perspectives can provide valuable context.
Absolutely. I've been in situations where the family's wishes conflicted with what the patient had previously expressed. It's heartbreaking, especially when there's no advance directive, and we're left trying to piece together what the patient would have wanted. In such cases, I find it helpful to have honest, compassionate conversations with the family to reach a decision that respects the patient's dignity while also considering the emotional toll on their loved ones. but ultimately the patient's rights should be at the center of our decision-making process.
Let's introduce another twist. What if a patient with a history of severe mental illness refuses a potentially life-saving surgery because they believe it's part of a conspiracy against them? They are otherwise physically healthy. Do we override their wishes?
This is where the principle of beneficence might come into play more strongly. If the refusal is clearly rooted in delusional thinking and the surgery is truly life-saving, there may be an ethical justification for overriding their refusal. However, this must be done with extreme caution, ensuring that the decision is driven by a genuine concern for the patient's well-being, not a paternalistic belief that we know what's best for them. In such cases, involving a mental health professional in the decision-making process is crucial.
I agree, and in practice, this is where interdisciplinary collaboration is key. As a physician, I would consult with a psychiatrist to assess the depth of the patient's delusions and their overall mental state. If the refusal is indeed delusion-driven, I would advocate for overriding their decision, but only after thorough discussions with the medical team, the patient, and their family. Even then, it's essential to handle the situation delicately to maintain the patient's trust and dignity.
Before we conclude, I'd like to bring in some philosophical perspectives. How do concepts like paternalism and the ethics of care influence this debate?
Paternalism, the idea of acting in someone's best interest against their wishes, is often seen as problematic in medical ethics because it conflicts with respect for autonomy. However, the ethics of care emphasizes relationships, empathy, and the moral responsibility to care for those who cannot care for themselves. In cases where a patient is not in their right mind, the ethics of care might justify a paternalistic approach, not out of disregard for autonomy, but out of a deep commitment to the patient's well-being. The challenge is finding the right balance between these ethical principles.
From a practical standpoint, the ethics of care resonates deeply with the day-to-day realities of medicine. We often find ourselves in positions where we need to protect our patients, sometimes from their own decisions. But I always strive to do so in a way that honors their humanity and maintains their dignity. It's not about being a savior. It's about being a compassionate caregiver who understands the complexities of the human condition.
As we wrap up, let's address the current stance on this issue in medical ethics. Dr. Fields.
The general view in medical ethics supports the principle that a patient's autonomy should be respected unless there is clear evidence that they lack decision-making capacity. When capacity is compromised, healthcare providers are encouraged to act in the patient's best interests, which may involve overriding their wishes. However, this should be done with careful consideration of the ethical implications, involving interdisciplinary teams, and when possible, respecting the patient's previously expressed wishes.
Thank you both for an enlightening discussion. The question of whether it's ethical to override a patient's wishes, if they are not in their right mind, remains one of the most challenging dilemmas in medical ethics. It's clear that while there may be general guidelines, each case is unique and requires careful, compassionate consideration. To our viewers, what are your thoughts? Should we prioritize patient autonomy, or does the duty to protect sometimes outweigh this principle? Comment below and let us know. Don't forget to subscribe and follow us for more thought-provoking discussions. And remember, in the world of ethics, the only thing clearer than the lines we draw is the care with which we navigate them.